All right, now we're going to talk about the treatment of rabies. Not a ton of stuff. There's drugs again. Like it's like this whole module is like this, right? All these little tiny lectures here, but again, could be on your board exam, so I want to make sure at least get you some of the drugs that could be used. It is luckily not super common here in the U.S., but it still can happen. It is more common, unfortunately, in Asia and Africa. So it is still an issue in the world. It's also because it's not super common here. Sometimes it goes undiagnosed here in the U.S. when it does happen. It's usually preventable after recognized exposure. So they do wound cleansing and they give the rabies vaccine and the rabies immune globulin. But unfortunately, that sometimes isn't available, especially if you're in rural areas and stuff, more isolated. So that can be an issue. The other issue too is some people don't realize that they're bit by a rabid bat, which I know sounds real scary. It's like Halloween. It's already past Halloween, but it's like Halloween style, right? So that can be something too that can kind of make the disease kind of hard to diagnose. Choosing a treatment, they have the palliative or aggressive approach, and so it's just going to kind of depend on your patient and what all the circumstances are, what's going on. Here is the cases of human rabies with recovery. I can see a number of different countries. The most recent one here in the U.S. was in 2004 via bat bite. So I believe this was the one up in Wisconsin. So many factors influence the approach. Like I said, here are some. I thought this was a good table to kind of guide you guys if you want to, if you're thinking about initiating an aggressive approach. If there's here are the factors that are favoring the aggressive approach, and these are the factors that are against an aggressive approach. So just go ahead and read through that. I'm not going to spend too much time on that. It's more ICM stuff, but anyway, so if you do go with the palliative approach, a lot of different drugs you're going to be taking into consideration, as well as some other things like a quiet room. So we have the benzodiazepines again making an appearance. Those can help to sedate the patient. Also related to that too, we haven't talked about haloperidol yet. Strong antipsychotic, older antipsychotic, but this can help too with agitation and restlessness, hallucinations, aggression, etc. Pain mitigation is important. So morphine, some of the opioids can be used for that. And if there is excessive salivary secretions, which is a unfortunate symptom, you can use anticholinergic medications. So we got a couple examples there, the scopolamine and the glycopyrrolate. And then if they have fever, you can use antipyretics. So something like Tylenol or ibuprofen. Oops. So acetaminophen and or ibuprofen. So this is an important slide. I would start this one. This is good for testing purposes for me. It gives you a lot of drugs and what they are used for. Depending on the culture, depending on the patients, they may not want to be in the hospital the whole time for treatment. And so this is just a slide just saying that you have to be mindful of their of that, and they may want to return home for privacy. So rare occasions, patients have survived after aggressive care and critical care units. And we go back to that table if you're still thinking about whether they should get the aggressive treatment. Supportive care is important. And I'm just going to kind of quickly go through these again because there's not a lot of drugs here. Read through it, and it may be beneficial again for ICM, but I don't want to just sit here and read these to you. Combination therapies as well, maybe a strategy for there. Immunotherapies is controversial, so that may be part of it. And again, we're talking about the aggressive approach versus the palliative approach. Immunotherapies too. Go ahead and read through those. Same thing here. Antiviral therapies. They're used, but there's despite a lack of evidence. So I don't have the listing of antiviral therapies, but they are here. So these are 3 that could be used, but don't stress too much about it for testing purposes for me. Really, I want you guys to focus on the palliative treatment. Read through the aggressive treatment approach, and note when there's drugs that are used and stuff, but mainly stick to that palliative approach. Antiviral therapy here, same thing. Just go ahead and read through it. Read through this one as well. Read through this. Just going through the specific antivirals and why some are favored over others and why some shouldn't be used and some should be used. Neuroprotective therapies. Again, it's kind of controversial. They're not sure exactly if it works or not. So just go ahead and read through that. The brain hypothermia may be a good idea to do. Some more neuroprotective agents that just go ahead and read through. A lot of them, these they still need more research done. This is again not a very common thing, so it's not a lot of data to support some of this stuff. Therapeutic coma. This is actually something that should be avoided, or that they suggest that it should be avoided. Therapies to avoid here, I would pay attention to these in the aggressive therapies, aggressive approach rather. Corticosteroids, minocycline, therapy coma, and prophylaxis for cerebral vasospasm should not be used. And then it goes through and explains why, so just go ahead and read through those, but know which ones they should be avoided. I think that'll be important. And yeah, same thing, avoid that. Oops, infection prevention. This one again is just FYI. I think this is beneficial users being healthcare workers, but as far as testing purposes, not going to pull test questions from here. So just read through that. Same thing here. This is just FYI stuff. And here are the summary recommendations. Good to read through and just make sure you kind of get a good overview of everything. That was super quick, but yeah. So basically, that one slide I told you to start, that everything else is good. Again, good context, hopefully help with ICM and some other things. So that is it for me. Hope you guys are having a good one wherever you're at right now. Feel free to email me any questions you have, and I will talk to you later.